close to the joint as you can get it. So just off the, usually find chromium. I'm gonna put my little finger there on the chromium. Just slide down just a little bit so that I'm on. So I don't get real head. And I can just post your glide here. This is where you can really try to keep your arm straight. Lean into it. You just sit here and do it with your arm, you're gonna get pretty fatigued pretty quick. So here I do, you get the posterior glide. Posterior glides you will use probably for the most of your shoulder motion, posterior and inferior glides. Canyon motion. Show you an anterior glide. If you think for external rotation, use an anterior glide. Most of the research shows that posterior glide works just as well as an anterior glide. I don't do a lot of anterior glides. Straight to the table, maybe slightly out.
So he's pulling at my elbow a little bit.
Yeah. A little distraction. Enough to distract me. I mean, I'm not really cranking on it. Enough to unload the shoulders. There, so I'm going to push down and maybe slightly out. Posterior, you can also do, this one I'll do sometimes. So I'm going to about 90 degrees, slightly horizontally adduct, and then push it down. Now adduct, based on the amount of forward posture of the shoulder. So if they're really, got a big protracted shoulder, then I'm going to adduct a little bit more. Try to look at their rounded shoulder posture. A little cheating way to look at that with posture analysis. I just watch them stand there. If I can see the back of their hand, they're just standing there, it tells me they've got a severely protracted, rounded shoulder, internally rotated shoulder. Something I have to adduct. Typically, most normal posture, you see their thumb pointing directly at you. Look at most people, they're going to be some sort of back of their hand posture. We're just all round shoulder.
So for that, would you just sit out and then put it in position?
So I'm going to, not necessarily follow their natural posture here, because they're going to be lying in that posture. So I use the towel to block that scapula, and I can get it right there. So it's nice and easy. There. Pretty comfortable.
Why'd you say you would horizontally adduct more?
So I get there this way, then if I don't adduct more, I'm going to be jamming that humeral head right back in their glenoid. That glenoid is, it's facing out, and the more protracted, round shoulder you get, so that glenoid starts facing anteriorly instead of more lateral. So if you don't adduct more, you're going to feel it's going to be really tight. Man, that thing's never loosening up. Then they just jam it, humeral head right into the glenoid.
So if they're already rotated a lot, you need more adduction.
Adduction a little bit more, yes. So,
I just want y'all to stay on this side so that I'm not ever doing
posterior glide,
videos.
We watching our good easy.
inferior glide,
He might.
same principles. Get your movement hands close to the glenohumeral joint as you can. Here I just try to keep them in a little bit of a neutral posture. I'm just going to shift my weight, get that inferior glide.
Can't see.
Straight down. Towards your feet. Get a little, all these I'm giving a little bit of a distraction of her shoulder here to unload it. Right there, straight down to her knee. If you look at my elbow, it should be pointed. Everything should be lined up this way. Just lean forward on bend my knees a little bit, lean forward. Okay. So that's technique, very good for loosening people up, give them the relax first before you go into your other joint modes. It's kind of a good prep. So, here's, try not to grasp with your fingertips. So, grasp it right there between your hands, so you don't dig your fingers into their skin. And I'm just gonna lean back, extract your shoulders, good stretch.
Do you oscillate or you just hold it?
You can, some people oscillate, and like your Maitland grades, so this is where you can really work on your grades. So if you're doing a posterior glide, you know, grade 1, just kind of wiggling it, get a good wiggle. Grade 2, get into about half of the range. Grade 3, you're going to large amplitude, end range, and grade 4 is very end range, small oscillations.
Does it matter what angle you're doing the stretch at?
I usually try to, if I know they're painful, somewhere around 90 is the most loaded position of the shoulder. Somewhere just below 90, 70. You don't want to do it in the position where they have the most